Neonatal sepsis. This is a clinical syndrome characterized by the systemic signs of infection and the bacteremia in the first 28 days of life. It is a significant cause of the neonatal morbidity and the mortality. Types of the neonatal sepsis. Early onset sepsis occurs within the first 72 hours of life, acquired during the birth from the maternal genital tract. Late onset sepsis, loss of occurs after the 72 hours of life, acquired from the environment, hospital, or the community. Early onset sepsis. Common pathogen group is Streptococcus, E. coli, Listeria monocytogenes, Klebsiella species. Late onset species. Common pathogen Staphylococcus epidermis, Staphylococcus aureus, Candida species, gram-negative bacilli. Risk factor. Maternal factors like chorioamnionitis, prolonged rupture of the membrane, greater than 18 hours, preterm labor, maternal GBS colonization. Neonatal factors like prematurity, low birth weight lesser than 2500 grams, invasive procedures like central lines and the intubation. Clinical feature, non-specific signs, poor feeding, lethargy or the irritability, hypothermia or the fever. Respiratory, grunting, tachypnea or the apnea. Cardiovascular, poor perfusion and the hypertension. Gastrointestinal, abdominal distension and the vomiting. Neurological, like seizures, bulging fontanelle. Jaundice, early or the prolonged. Skin changes, petechiae, purpura or the moting. For the diagnosis, a clinical evaluation like non-specific signs requires a high index of suspicion. Laboratory investigation, blood culture, gold standard, positive in lesser than 50% of cases. CBC, liquefenia, lesser than 5000 MI, neutropenia or the thrombocytopenia. C-reactive protein, elevated level. Procalcitonin, more specific marker for the bacterial species. Lumbar puncture, if meningitis is suspected. Urine culture, if in loss or if UTI is suspected. For imaging, chest X-ray for the pneumonia. Abdominal ultrasound if the necrotizing enteric colitis is suspected. Management, empirical antibiotics. For EOS, ampicillin for gentamicin or cefotaxime. For loss, vancomycin plus gentamicin or the cefotaxime. Modify based on culture and the sensitivity results. Supportive care, oxygen or the mechanical ventilation for the respiratory distress, fluid execution for the shock, inotropic support if the hypertension persists, management of the metabolic abnormalities, example hypoglycemia and acidosis. Preventive measures like maternal intrapartum antibiotic prophylaxis for GBS. Strictly handle the hygiene in the NICUs. Early removal of the invasive devices. Complications like meningitis, septic shock, disseminated intravascular coagulation, multi-organ dysfunction syndrome, long-term neurodevelopmental issues in the survivors. Neonatal sepsis is divided into early onset, lesser than 72 hours, and late onset, greater than 72 hours category. Common causes, EOS, GBS and E. coli. LOS, coagulase negative Staphylococcus aureus. Blood culture is the gold standard for the diagnosis. CRP and the procalcitonin are useful inflammatory markers. Empirical therapy includes ampicillin plus gentamicin, vancomycin and gentamicin. Chorioamnionitis and prolonged rupture of the membrane, major maternal risk factor. Preventive strategies, maternal GBS prophylaxis and the strict NICU hygiene. Complications like meningitis, shock and the long-term neurodevelopment impairment.